I want to return now to our coverage of COVID-19. As we headlined a short time ago, the Health Minister warning that a second wave of COVID-19 infections likely to surpass the first. And you'll know that from today, visitors from South Africa will not be allowed to enter the United Kingdom due to the outbreak of a new variant of COVID-19. I want to talk now to Dr. Richard Lessells, an infectious diseases specialist and group leader at the KwaZulu-Natal Research Innovation and Sequencing Platform at the University of KwaZulu-Natal. Dr. Lessells, good afternoon to you. Thank you so much for joining us. First of all, maybe a good starting point for us would be to get the difference between what a variant is and what a new strain is.
Well, I mean, you're hearing a lot over the past few days of these different terms. We bandy about these terms: variant, strain. You've also heard this term lineage. The correct term actually is lineage, and really you can think of that if you think of all the viruses that are circulating as being part of a family tree. You can think of a lineage as one branch of that tree, and all the viruses are genetically very similar on that branch of the tree. And so when we talk about this variant this new variant that is spreading very rapidly in South Africa, it's really a new lineage, and it's a virus that we found that looks considerably different to the other viruses that were spreading around the country previously.
And Dr. Lessells, what is the consequence or the impact of that? We've heard that it spreads more quickly. I've heard the phrase spreading more efficiently. We've also seen some reports saying that it's more dangerous. What is it?
Well, the evidence we have at the moment certainly suggests that this variant does transmit more efficiently. So by that we mean it seems to be a bit better at spreading from person to person. Of course, the reality is this virus was not having much difficulty spreading from person to person even before this new variant. So the spread is largely still determined by human behavior. And so the rapid spread that we're seeing, although this new variant may be contributing to that, the primary factor is still human behavior and the fact that we are all, unfortunately, still having too much close contact with other people.
The United Kingdom has made the call not to allow South Africans to go into the country. There's a temporary ban, as you're well aware. Is that a responsible call?
Well, I mean, that's not really for us to say. I mean, we've seen previously that what you're detecting by the genomic sequencing is often the tip of the iceberg. And so what we saw at the beginning of the epidemic in many parts of the world was these travel bans actually had limited impact because there was already more spread than you were detecting with your surveillance systems. And that's likely to be the case here, that there's probably already been more spread than we know about at the moment. And certainly we won't be surprised if in the next couple of weeks or so we start detecting the UK variant here in South Africa, because there's a lot of travel between the two countries. And so this is how the virus spreads internationally and how we've seen throughout this pandemic.
How widespread worldwide is this new variant then? What do we know about that?
In terms of the South African variant, so all we know at the moment is that it's been detected in these 2 cases in the UK. So those are the only 2 cases we know about outside of South Africa. But again, part of the reason for this is that South Africa and the UK have amongst the strongest genomic surveillance systems in the world. So we're doing this systematic tracking of the virus, regularly sequencing the virus from different parts of the country to see how it's evolving over time. Many other countries around the world, and particularly many other countries in Africa, are actually doing very limited sequencing, and certainly recently very limited sequencing. So that makes it very challenging to understand the spread, the dissemination of these new variants. And really the finding both here in South Africa and the UK is really highlighting how important this genomic surveillance is to inform the public health response around the world.
Dr.